Pathology. Definition. It is a branch of medical science which deals with the nature, causes, effects and consequences of diseases. It involves with the investigation of the causes of the diseases, that is etiology, and the cause is associated with the changes at the level of cells, tissues and organs, that is pathogenesis. Etiology and pathogenesis are the basic things to consider during the treatment of a patient, which in turn deals with the developments and ultimate result or prognosis of the disease as a foundation for the practice of medicine. These changes of the cells or the tissues may be gross or microscopic. As the levels of the changes are various, this discipline is divided into two main parts. Number one, general pathology, and number two, systemic pathology. General pathology focuses on the cellular and tissue alteration caused by pathological stimuli, and systemic pathology describes the reactions and abnormalities of different organs to such abnormal stimuli. Morphology, abnormal anatomy, gross, microscopic, radiological changes comes under the heading of morphological changes, and microbiological clinical expressions are the signs and symptoms of a disease felt and observed by the patient. They are verified by the physician himself on examining the patient as well as tested with laboratory investigations when and wherever it is required. Besides these abnormalities, cells maintain a steady state by maintaining its intra and intercellular physiological parameter known as homeostasis. But an abnormal stimuli can cause a disturbance in the activity of a cell, for which the cells try to maintain its viability and function, known as adaptation. A persistent abnormal stimuli causes an irreparable condition of the cells, leading to premature or untimely death of the cells, known as necrosis. Inability of cells to adapt to stress leads to either of the results. First, injury of the cell either as apoptosis or necrosis. Normal process of replacement of the cells after its death is called apoptosis. It is a programmed cell death, a normal phenomenon of development. Usually, no noticeable symptoms develop during these changes. They are engulfed by WBCs. Another process of cell death is a premature or untimely death due to some causes, that is known as necrosis. It is always detrimental, showing noticeable signs and symptoms like swelling, pain, etc. at the affected tissues. There is a number of changes that take place in the cellular biology in response to adverse environmental changes, and these changes are to maintain the viability of the cells by exchanging their essential materials through the cell membrane with an increased permeability, and this is known as adaptation. There are different forms of adaptation to respond to stress or stimuli. Following are the major types of adaptations. Number 1, atrophy, hypertrophy, hyperplasia, metaplasia, dysplasia and anaplasia. If we describe them, atrophy, ischemia or lack of blood supply to an organ or part of the body leads to shrinkage of that part known as atrophy, and such changes may be physiological or pathological. Best example of physiological atrophy are atrophy of the uterus and breast after menopause, atrophic changes in the bones and muscles in elderly persons. In case of pathological atrophy, organs remain small due to lack of blood supply and thereby nutrition is hampered. And kidney involved with the atherosclerosis goes under the condition of atrophy or due to hardening